Good morning, everyone. This morning we're going to talk about fractures of the wrist. One of the most common fractures in orthopedics, and how do you know you had it? Well, you took a lick and it's going to hurt. Our forearm is real rigid in the middle of it. All right, the bone is thicker, and as it comes down towards the wrist, it balloons out, but it gets thinner, and that's where it likes to fit. And even if you don't have a visible deformity, but you have a lot of pain and swelling, it's reasonable to go get that x-rayed. And you can do it at an urgent care facility, an emergency facility, at Express Care here at Colorado Springs Orthopaedic Group. They will evaluate that with x-rays, and not all of these fractures need to be operated on. Fractures in the distal radius, that bone is very vascular and that bone wants to heal. It's going to heal most of the time, almost no matter what you do with it. But the position of it matters. We need them to heal, and we need them to heal in a position that keeps you functioning. The close cousin to this is just beyond the distal radius, the small bones in your wrist. All right, those are called the carpals. All right, usually the same mechanism. You have some kind of lick that you've obtained, and often it's to the fall in the outstretched hand. Here's the interesting thing about that. Very different from the distal radius, it doesn't hurt that bad. And that's the problem we get with these, is they often feel like a vague sprain. And at least half of the presentations I see for scaphoid fractures or carpal fractures, they show up later, weeks, months, maybe even years later, because the patient didn't know that they had a fracture. So if you have significant impact to your wrist and it's sore in here, maybe swells a little bit, but it doesn't really feel that bad, still a good idea to go get it checked out. If you have any questions about one of these injuries with you or your family, you're welcome to come see either myself or Dr. Dale Cassidy at Colorado Springs Orthopaedic Group, 719-632-7669. Thanks. Have a good morning.